So can complications from surgery actually be life-threatening? We really take it for granted. I'm Dr. Partha Nandi, and talking to you today about the fact that, could a complication from surgery actually be life-threatening? A lot of my patients, say, "Oh, I want to just get surgery and get it taken care of," and we forget that surgery has what complications that are potential. Listen, I'm not going to tell you that surgery shouldn't be done. I think in the right hands and so many times it's very, very safe. However, remember that people can get complications from surgery. Let's define what complications are. First of all, that complications are things that happen, right, that are not part of the process. The part of the process of healing, the process of recuperating. So stuff that happens that you really are not expecting. So what are some examples? You can get, for example, you can get shock from losing blood. You can get blood loss to such an extent that you can get hypovolemic shock. You can also get brain trauma, and that can give you shock. You can also get metabolic issues. So all these things can really cause problems for you. And again, most people don't get them, but if you do, they can threaten your life. So it's important to make sure that everything that you do to prepare yourself for this. So I think that super important to know exactly what's going on. So let's talk about other things that can happen, other conditions, other surgical complications after surgery. You can get, for example, a wound infection, right? So you get a cut and then a wound, and that wound then gets bugs in it and get infected, and then go through all over your body. So that's not a good thing. And also you can get what's called a pulmonary embolus. So what is that? It's a blood clot that goes into your lungs. So you can get a blood clot in your legs, in your arms, and then that's often after surgery. What you're sitting around, you're not doing as much as you want to, and the blood can pool. It can cause blood clots, and that blood clot then goes from that area into your lungs. Could be life-threatening. Could take your life. So very important to know that. And so, go into surgery knowing that this could be something that happens. In addition, you want to make sure you ask your doctor about the surgery that you have. Is it high risk, low risk? Is it intermediate risk? So you go in prepared, and then after you have the surgery, know the signs, right? So if you're having little aches and pains, then I guess if you're sure that, hey, everything is okay, then you should be rest assured. But if you have any questions, go see your doctor right away. In addition, if you have any chest pain, if you have trouble breathing or a rapid heartbeat, any of those things, you want to make sure you go to the emergency room right away. Get the help you need, because if you don't, it could be life-threatening. So it's really important to make sure that you get the help that you need and be prepared. So again, I'm not saying that you shouldn't have any surgery, but when you go into surgery, go and also be informed. Risks versus benefits. So what does that mean? Risk versus benefits means that you want to make sure that you get all the ideas of, if you're having surgery, what are the benefits of having surgery versus the risks of having surgery. So really critically important. And you always want to go to a surgery that you know that the benefits outweigh the risks. And so whatever you're having done, don't just jump the gun and say, I'm going to have it done, I'm just going to cut it out, or whatever it is going to be safe. You want to ask your doctors, make an informed decision. We're talking about this because of a tragedy. Sergio Marchionne, former CEO of Fiat Chrysler, actually had a shoulder surgery and now is in a critical condition in an ICU. Now, I'm not saying that you should panic if you have surgery. Absolutely not. But just be informed. Know that your condition after surgery could maybe worse than it is before. So you want to have that, take and put that in your mind before making a decision about surgery. So remember, as always, make healthy living a part of every day. Thanks for watching today, and any questions, let me know. Namaste.